Assalamu alaikum. Welcome my channel Ali TV. Today topic is skin cancer. It's it's a danger disease. Many cases report of skin cancer in Australia. 80%. Let's start. What is skin cancer? Skin cancer, the abnormal growth abnormal growth of skin cells most often develops or skin exposed to the sun, but this common form of cancer can also occur on areas of your skin not ordinarily exposed to the sunlight. There are the three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. You can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet radiation. Checking your skin of suspicious changes can help detect skin cancer at its earliest stage. Early detection of skin cancer gives you the greatest chance for successful skin cancer treatment. Types of skin cancers: basal cell carcinoma, melanoma, non-melanoma skin cancer, squamous cell carcinoma of the skin. Symptoms: where skin cancer, symptoms of skin cancer, where skin cancer develops. Skin cancer develops primarily on areas of sun exposed skin, including the scalp, face, lips, ears, neck, chest, arms, and hands, and on the legs in women, but it can also form on the area that rarely see the light of day: your palms, beneath your fingernails or toenails, and your genital area. Skin cancer affects the people of all skin tones, including those with darker complexions. When melanoma occurs in people with dark skin tones, it's more likely to occur in areas not normally exposed to the sun, such as the palms of the hands and soles of the feet. Basal cell carcinoma. Signs and symptoms: basal cell carcinoma usually occurs in sun-exposed areas of your body, such as your neck or face. Basal cell carcinoma may appear as number one, a pearly or waxy bounce. Number two, a flat, flash occurs or bronze scale-like lesion. Number three, a bleeding or scabing sore that heals and returns. Next major heading: squamous cell carcinoma. Signs and symptoms. Most often, squamous cell carcinoma occurs on sun-exposed areas of your body, such as your face, ears, and hands. People with darker skin are most likely to develop squamous cell carcinoma on areas that are not often exposed to the sun. Squamous cell carcinoma may appear as a firm number one, a firm red reduced. Number two, a flat lesion with a scaly crusted surface. Major heading and melanoma. Signs and symptoms: melanoma can develop anywhere on your body or in otherwise normal skin or in an existing mole that becomes cancerous. Melanoma most often appear on the surface or trunks of the affected man. In women, these types of cancer most often develop on the lower legs. In both men and women, melanoma can occur on skin that has not been exposed to the sun, and melanoma can affect people of any skin tones. In people with darker skin tones, melanoma tend to occur on the palms or soles or other the fingernails or toenails. Melanoma signs include: number one, a large brownish spot with darker speckles. Number two, a mole that changes in color, size, or feel, or that blind. Number three, small lesion with an irregular border and portion that appear red, pink, white, blue, or blue black. Number four, a painful lesion that is stitches or burns. Number five, dog lesion. Point number five, dog lesion on your palms, soles, and fingertips or toes, or on mucous membrane lining or your mouth, nose, vagina, or anus. Signs and symptoms of less common skin cancer. Other less common types of skin cancer. Number one, Kaposi's sarcoma. This their rare form of skin cancer develops in the skin blood vessel and causes red or purple patches on the skin or mucous membrane. Kaposi's sarcoma mainly occurs in people with weakened immune system, such as people with AIDS, and in people taking medication that suppress their natural immunity, such as people who undergo organ transplant. Other people with an increased risk of Kaposi's sarcoma include young men living in Africa or other men of Italian, Eastern European, Jewish heritage. Next point, Merkel cell carcinoma. Merkel cell carcinoma causes firm shiny nodules that occurs on or just beneath the skin and in the hair follicles. Merkel cell carcinoma is most often found on the head, neck, and trunk. trunk. Next point, sebaceous gland carcinoma. This unknown and aggressive cancer originates in the oil gland in the skin. Sebaceous gland carcinoma, which usually appears as hard, painless nodules that can develop anywhere, but most occurs on the yield where they are frequently mistaken for other eyelid problems. When to see a doctor? When make an appointment with your doctor if you notice any change to your skin that worry you. Not all skin changes are caused by skin cancer. Your doctor will investigation your skin changes to determine a causes causes of skin cancer. Skin, skin cancer causes when or error mutation occurs in the DNA of skin cells. The mutation occurs the cell to grow out of control and forms masses of cancer cells. Cell involved in skin cancer. Skin cancer being in your skin soft layer, the epidermis. The epidermis is a thin layer that provides a protection cover of skin the cells that your body continuously sheds. The epidermis contains three main types of cells. Number one, squamous cell lies just below the outer surface and function as the skin inner lining. Number two, basal cell, which produce new skin cells, sit beneath the squamous cells. Melanocytes, which produce melanin, the pigment that gives skin its normal color, are located in the lower parts of your epidermis. Melanocytes produce more melanin when you are in the sun to help protect the deeper layer of your skin. Where your skin cancer being determined in its types and your treatment option, ultraviolet light and other potential causes. Much of the damage to the DNA in skin cells result from ultraviolet radiations found in sunlight and in the light used in the tanning beds, but sun exposure does not explain skin cancer that develop or skin not ordinarily exposed to sunlight. This indicates that other factors may contribute to your risk of skin cancer, such as being exposed to a toxic substances or having conditions that weaken your immune system. Risk factors that may increase your risk of skin cancer include fair skin. Number one, risk of factors that may increase your risk of skin cancer include: number one, fair skin. Point number one, fair skin. Anyone, regardless of skin colors, can get skin cancer. However, having less pigment in your skin provides less protection from damage UV radiation. If you have blonde or red hairs and light-colored eyes, and you freckles or sunburn easily, you are much more likely to develop skin cancer than is a person with a darker skin. History of sunburns. Having had one or more blistering sunburns as a child or teenager increase your risk of developing skin cancer. As an adult, sunburns in adulthood are also a risk factor. Number three, excessive sun exposure. Anyone who has spent considerable light time in the sun may develop skin cancer, especially if the skin is not protection with the sunscreen or clothing. Tanning, including exposure or tanning the lamps and beds, also puts you to a risk of tanning is your skin injury response to excessive UV radiation. Sunny or high altitude climates. People who live in sunny, warm climates are exposed to more sunlight than are people who live in colder climate. Living at high elevation where the sunlight is strongest also exposes you to more radiation. Number three, moles. People who have many moles or abnormal moles called dysplastic nevi and are at increased risk of skin cancer. These abnormal moles, which look irregular are generally larger than normal moles, are more likely than others to become cancer. You have a history of abnormal moles, watching them are regularly for changes. Pre-cancer. Next point, pre-cancer skin lesions. having skin lesion known as the actinic keratosis can increase your risk of developing skin cancer. These precancerous skin growth typically appear at of scaly patches that range in color from brown to dark green. They are most common on the face, head, and hands of fair the skin. The people whose skin has been sun damaged. Next point, our family history of skin cancer. If one of your parent or the sibling has had skin cancer, you may have increased of the disease. Next point, personal history of skin cancer. You develop skin cancer when you are at risk of developing it again. A weakened immune system. Next point, weakened immune system. People with a weakened immune system have a greater risk of developing skin cancer. This includes people living with HIV and AIDS, and those taking immunosuppressant drugs after an organ transplant. Number next point for 02 radiation. People who receive radiation treatment for skin conditions such as eczema and may have an increased risk of skin cancer, particularly basal cell carcinoma. Next point, exposure to certain substances. Exposure to certain substances such as arsenic may increase your risk of skin cancer. Prevention of skin cancer, it's an important point. Most skin cancer are preventable. To protect yourself, follow these skin cancer prevention tips. Number 1, avoid the sun during the middle of the day. For many people in North America, the sun rays are stronger between about 10 a.m. to 4 p.m. Schedule outdoors activities for other times of the day, even in the winter or when the sky is cloudy. You absorb UV radiation yearly round, and cloud offer little protections from damaging rays. Avoiding the sun at its strongest helps you avoid the sunburns and suntans that cause skin damages, increasing your risk of developing skin cancer. Sun exposure cumulatively over time also causes skin cancer. Wear sunscreen year round. Sunscreen does not filter out all harmful UV radiation, especially. Number 2 point, wear sunscreen year round. Sunscreen does not filter out all harmful UV radiation, especially the radiation that can lead to melanoma. They play a major role in all overall sun protection. Usually a broad spectrum sunscreen with the SPF of at least 330. Even on a cloudy days, apply sunscreen generously and rapidly, even to also more often if you are swimming and persevering. You use a generous amount of sunscreen on all exposed skin, including your lips, the tips of your ears, and the backs of your hands and neck. Next point, wear protective clothes. Sunscreen does not provide complete protection from UV rays, so cover your skin with dark, tightly woven clothing that cover your arms and legs, and a broad-brimmed hats which provide more protection than a baseball cap or beer does. Some companies also sell photoprotective clothing. Our dermatologist can recommend it as appropriate brand. Don't forget sunglasses. Don't forget sunglasses. Look for those that block both types of UV radiation, UVA, UVB rays. Next point, avoid the tanning beds. Like using tanning beds, they emit UV rays and can increase your risk of skin cancer. Next point, be aware of sun sensitizing medication. Some common prescription and over-the-counter drugs, including antibiotics, can make your skin more sensitive to sunlight. Ask your doctor or pharmacist about the side effects of any medication you take. If you increase your sensitivity to sunlight, take extra precaution to stay out of the sun in order to protect your skin. Next point, check your skin regularly and report changes to your doctor. Examine your skin often of new skin growth or changes in registering moles, freckles, bumps, and birthmarks. With the help of mirror, check your face, neck, ears, and scalp. Examine your chest and trunks and the tops and underside of your arms and hands. Examine both the front and back of your legs and your feet, including the soles and the space between your toes. Check your genital areas between your buttocks. Please share this videos, like and comments, and click subscribe and click the bell icon button. Thank you.